This bedtime routine may help calm joint pain naturally. What if the one thing destroying your joints is happening every single night while you sleep? Not your diet, not your exercise routine, not even your age. Something quieter, something most people completely overlook. And the terrifying part, the more you ignore it, the worse it gets, silently, in the dark, while your body is supposed to be healing. I know that sounds alarming, but stay with me, because what I'm about to share with you might be the most important thing you've ever heard about joint pain, and it has nothing to do with painkillers, expensive supplements, or anything your doctor has probably ever mentioned. Millions of people wake up every single morning feeling stiff, achy, and exhausted, like their body aged 10 years overnight. They blame their mattress. They blame the weather. Some even blame getting older, as if pain is just something you're supposed to accept. But what if that's completely wrong? What if there are specific things you can do tonight, before you close your eyes, that could dramatically change how your joints feel when you wake up? Today, we're going to walk through 7 bedtime habits that may help calm joint pain naturally. These aren't random tips pulled from a wellness blog. These are grounded in real science, real studies, and the kind of knowledge that took researchers decades to piece together. And by the time we're done, you're going to look at your nighttime routine in a completely different way. But here's the thing I need you to hold on to as we go through this. I'm going to save the most important one for last, because it's the one thing almost nobody talks about, and it might be the single biggest reason your joints aren't recovering the way they should. So don't skip ahead. Every single point builds on the one before it. Let's get into it. Have you ever woken up in the morning feeling like your hands were made of concrete? Like before you can even think about your day, you have to spend 10 or 15 minutes just waiting for your body to catch up to your brain? If that sounds familiar, you already know the frustration. And most people assume that morning stiffness is just a sign of aging or arthritis flaring up overnight. But here's what they don't know, and this is important. Morning stiffness is often less about what happened overnight and more about what you didn't do before bed. Here's the hidden truth. Your joints are surrounded by something called synovial fluid, a thick, slippery liquid that acts like motor oil for your body. It lubricates the joint, absorbs shock, and carries nutrients to your cartilage. And just like motor oil in a cold engine, synovial fluid thickens when you're inactive for long periods of time. When you lie still for 7 or 8 hours, that fluid settles, thickens, and loses its ability to move freely through the joint. The result? That grinding, concrete-like stiffness you feel the moment you try to get up. A study published in the journal Arthritis Care and research found that people with inflammatory joint conditions who perform gentle range of motion movements before sleep experienced significantly less morning stiffness compared to those who went straight to bed without any movement. The researchers believe this was because gentle motion before sleep helps distribute synovial fluid more evenly throughout the joint, so it has a better baseline to start from as it settles during the night. Think about what that means emotionally. That first 30 minutes of your morning, when you're stiff and slow and hurting, sets the tone for everything that follows. When you feel pain the moment you wake up, it's hard to feel optimistic. It's hard to feel capable. It shapes your whole day before it even really begins. A simple change before bed could mean the difference between waking up dreading movement and waking up feeling like yourself again. So what can you do? Tonight, before you get into bed, spend just 5 to 8 minutes doing gentle joint mobility work. Not stretching, not exercise, mobility. Slowly rotate your ankles. Gently circle your wrists. Roll your shoulders. Move your knees slowly through their full range of motion. You're not trying to work out. You're trying to tell your synovial fluid where to be. Think of it as stirring the oil before you park the car for the night. It sounds almost too simple, but that simplicity is the point. The things that help us most are often the ones we keep dismissing because they don't feel dramatic enough. And speaking of things that don't get enough credit, the second point is about something your body desperately needs at night, something that directly controls inflammation in your joints, and something most people are unknowingly destroying before they even lie down. We'll get to that right after this. Have you ever noticed that when you don't sleep well, everything hurts more? Your back aches a little extra. Your knees feel raw. Even your fingers feel swollen and tender. You probably chalked it up to a rough night. But what if I told you that's not a coincidence? What if your sleep quality and your joint pain are connected in a much deeper, more biochemical way than you ever realized? Here's what most people don't know. While you sleep, your body enters what scientists call its repair cycle. This is when it produces anti-inflammatory compounds, rebuilds damaged tissue, and regulates the immune response that controls how much inflammation you experience. One of the key players in this process is a hormone called cortisol. Cortisol is naturally low at night, which is actually a good thing, because low cortisol allows your body's repair mechanisms to work without interference. But when your sleep is disrupted, when you're not getting deep, restful sleep, your cortisol stays elevated. And elevated cortisol at night is directly linked to increased systemic inflammation, which means more joint pain. Researchers at the University of Pittsburgh found that people with chronic pain who reported poor sleep quality had significantly higher levels of inflammatory markers, specifically interleukin-6 and C-reactive protein, than those who slept well. What's fascinating and terrifying at the same time is that the relationship works both ways. Poor sleep worsens inflammation, and inflammation worsens sleep. It's a cycle that can trap people for years without them ever understanding what's driving it. And emotionally, this is one of the cruelest parts of living with joint pain. You're exhausted because you're in pain, but the exhaustion is also making your pain worse. You're running on empty and trying to heal at the same time, and your body simply cannot do both effectively. People in this cycle often feel hopeless, like no matter what they try, nothing really works. That hopelessness is real, but it's also in many cases solvable. The solution here is about something called sleep hygiene, specifically the 90 minutes before bed. This window is critical. Your brain needs to drop its core temperature slightly to initiate deep sleep, and it needs to begin winding down its stress response. So tonight, try this. 90 minutes before bed, dim every light in your home. Bright light, especially blue light from phones and televisions, signals your brain to stay alert and suppresses melatonin, the hormone that triggers deep sleep. Swap bright overhead lights for lamps. Put your phone face down, or in another room. Keep the temperature in your bedroom cool. Around 65 to 68 degrees Fahrenheit is widely considered optimal. These aren't just comfort tips. These are neurological signals that tell your body it's time to shift into repair mode. Now, here's where it gets even more interesting, and this next point connects directly to what we just talked about, because there's a specific time of night when your inflammation levels naturally peak, and what you consume in the hours before that window could either feed that inflammation or fight it. This one surprised me when I first learned about it, and I think it'll surprise you too. Have you ever eaten a late-night snack, something you thought was totally harmless, and woken up the next morning feeling puffier, stiffer, and more inflamed than usual? Maybe you blamed the weather. Maybe you thought you just slept in a weird position. But here's the thing. Your gut and your joints are talking to each other all night long. And what you eat in the 2 to 3 hours before bed might be either calming that conversation or setting off alarm bells. Here's what the science shows. Your gut microbiome, the trillions of bacteria living in your digestive system, plays a direct role in regulating systemic inflammation. When you feed your gut the wrong things right before sleep, you trigger what's called intestinal permeability, or informally, leaky gut. Inflammatory compounds called lipopolysaccharides can pass through the intestinal wall and enter the bloodstream, where they travel to joints and amplify the pain signals already happening there. And this process is more active during certain nighttime hours, particularly between 2 and 4 in the morning, which is also when many people report their worst joint pain. A study published in Cell Host and Microbe found that the composition of your gut bacteria directly influences the severity of arthritis symptoms in both animal models and human subjects. Researchers were able to reduce joint inflammation significantly by altering the gut environment. The connection between what you eat and what you feel in your joints isn't indirect or theoretical. It's biochemical, it's measurable, and it's happening inside you every single night. This hits hard when you think about it personally. How many times have you had a difficult day, reached for comfort food at night, chips, ice cream, something sugary or processed, and then woken up feeling terrible? You thought you were just treating yourself. You didn't realize you might have been feeding the very inflammation that was keeping you in pain. That's not guilt, that's information. And information can change everything. So here's what to consider. In those 2 to 3 hours before bed, try to avoid refined sugars, processed snacks, alcohol, and anything heavily fried. These are the foods most strongly linked to gut permeability and inflammatory spikes. Instead, if you need something, reach for a small amount of tart cherry juice, one of the most well-researched natural anti-inflammatory foods in the world. A study from a European Journal of Nutrition found that tart cherry consumption reduced markers of inflammation and improved sleep quality in participants with chronic pain conditions. Or try a small handful of walnuts, which are rich in omega-3 fatty acids that directly compete with the inflammatory pathways in your joints. Small choices, big downstream effects. And that brings me to point 4. Because once you've started calming the internal fire, there's something you can do on the outside of your body, literally, physically, before you get into bed. That could change what happens to your joints while you sleep. And this one goes back centuries, with modern science now finally explaining exactly why it works. Have you ever taken a warm bath or shower before bed and noticed that you slept unusually well that night? Like something just released? You might have assumed it was the warmth or just the ritual of it. But what's actually happening is far more specific. And when you understand it in the context of joint pain, it becomes one of the most powerful tools you have. Here's the hidden truth. Heat applied to joints before sleep does 3 distinct things. First, it dilates the blood vessels around the joint, increasing circulation and delivering more oxygen and nutrients to the cartilage and surrounding tissue. Second, it reduces muscle tension around the joint, and this matters enormously because much of joint pain is actually amplified by tight, guarding muscles that clench around a painful area and restrict movement further. Third, and perhaps most surprising, it signals the nervous system to downregulate pain sensitivity, literally turning down the dial on how loudly the pain signals are firing. A clinical study published in the Journal of Clinical Rheumatology found that thermotherapy, heat treatment, applied before sleep significantly reduced pain scores and morning stiffness in patients with osteoarthritis of the knee. The researchers noted that the effect was particularly pronounced when heat was applied in the 30 minutes immediately before sleep, suggesting that the timing matters just as much as the method itself. And here's the emotional piece. Joint pain is exhausting in a very specific way. It's not just a physical ache, it's the constant awareness, the weight of always knowing your body is in distress. Finding something that gives you even 30 minutes of genuine relief before sleep is almost indescribably valuable. It's a moment of peace that your nervous system desperately needs, not just for comfort, but for the neurological unwinding that makes real sleep possible. The practical application here is straightforward but specific. A warm bath, not hot, warm, around 100 to 102 degrees Fahrenheit, for 15 to 20 minutes, with about a cup of Epsom salt dissolved in the water. Epsom salt is magnesium sulfate, and the magnesium absorbs through the skin, contributing to muscle relaxation and potentially reducing inflammatory markers. After the bath, apply a warm compress or a heat pad to your most affected joints for another 10 minutes. Then get directly into bed. The drop in your body temperature after the warm bath will actually signal deep sleep onset even more strongly. You're using thermodynamics as a healing tool. Now, if you've been following along, we've covered movement, sleep quality, what you eat, and heat therapy. But I have to pause here for just a second, because if this is resonating with you, if you're recognizing yourself in any of this, then you are exactly the kind of person this channel exists for. If you haven't already, take a second, subscribe, and give this video a like. It genuinely helps this information reach more people who are sitting at home in pain, wondering why nothing seems to work. It means more than you know. Now, back to the 5th point, because this is where things get really fascinating. Have you ever thought about the position you sleep in? Not just whether it's comfortable, but whether it might actually be working against your joints all night long, for 7 or 8 hours straight, while you're completely unaware? Most people have never considered this. They find a position that feels okay when they first lie down, and they stick with it for years, sometimes decades. But here's what they don't realize. Certain sleep positions place chronic, sustained compression on specific joints. Others keep joints in shortened, flex positions for hours at a time, which causes the surrounding connective tissue to adapt and tighten, making morning stiffness dramatically worse. And some positions cut off circulation to joints that are already struggling to get the nutrients they need. Research from the journal Sleep Health found that sleep position significantly affects musculoskeletal pain and recovery, particularly in the hips, knees, and shoulders. People who slept in certain positions without support reported higher levels of morning pain than those who used targeted positioning with pillows. The body, when left unsupported in the wrong alignment for hours, does not rest. It quietly strains. Think about this. If you have knee pain, and every night you sleep with your knees bent and pressed together or twisted to one side, you're spending a third of your life actively compressing the most vulnerable parts of that joint. If you have hip pain and you sleep directly on that hip, night after night, you're loading a joint that desperately needs decompression. The pain you feel every morning might not be mysterious at all. It might be a completely predictable result of how you've been sleeping. Here's what to try. If you sleep on your side, which is generally considered the most joint-friendly position, place a firm pillow between your knees. This one change keeps your hips, pelvis, and lumbar spine in neutral alignment and takes the compressive rotation off your hip and knee joints all night. If you prefer sleeping on your back, place a pillow or a rolled-up towel under your knees. This slightly flexes the knee joint and dramatically reduces attention to the lower back and hip flexors. If you're a stomach sleeper, I'll be direct with you. This is one of the worst positions for joint health across the board. The neck twisting alone creates compressive forces that radiate down through the shoulders. If you can begin training yourself away from it, your body will thank you. And now we get to point 6. And this one is perhaps the most counterintuitive thing in this entire video, because we've been talking about things you do before bed. But point 6 is about something happening in your mind, something that directly and measurably changes how your body processes pain during the night. This one changed the way I think about healing entirely. Have you ever noticed that on days when you're stressed, anxious, or emotionally drained, your pain feels worse? Not just slightly worse, dramatically worse? Like the same joint that was a 3 out of 10 on a calm day suddenly becomes a 7 when you're overwhelmed? Most people assume this is just psychological, that they're more sensitive when they're stressed. But the reality is so much more physical than that, and understanding it changes everything. Here's what's actually happening. Chronic psychological stress activates the body's sympathetic nervous system, the fight or flight response. When this system is activated, your body releases inflammatory cytokines, tightens muscles around vulnerable joints, reduces blood flow to peripheral tissues, and amplifies the sensitivity of pain receptors throughout your body. This is all measurable. This is all biological. And if you go to bed with your nervous system in this activated, vigilant state, which most people do because they spend the last hour of their day scrolling through anxiety-inducing content, your body spends the entire night in a low-grade stress response instead of a healing response. A landmark study from the Ohio State University found that psychological stress directly increased inflammatory markers, specifically interleukin-1 beta and tumor necrosis factor, in people with arthritis. The researchers concluded that stress management was not a soft or optional component of joint health. It was, in their words, a direct biological lever on inflammation. And here's the emotional reality of this that most people never talk about. When you're in chronic pain, stress is almost unavoidable. Pain causes stress. Stress causes more pain. It's another cruel loop, spinning silently in the background of your life, making everything harder. And nobody tells you that breaking the stress cycle is one of the most powerful things you can do for your joints. They just tell you to take another pill. The solution here is a practice called progressive muscle relaxation, combined with slow diaphragmatic breathing. And together, they are one of the most well-documented methods for shifting your nervous system from sympathetic to parasympathetic before sleep. Tonight, once you're in bed, starting from your feet and moving slowly up your body, tense each muscle group for 5 seconds, then release completely. Feel the difference between tension and release. When you reach your face, pause, and then spend 5 minutes breathing in 4-7-8 rhythm. For seconds in, hold for 7, out for 8. This breathing pattern activates the vagus nerve, which directly signals your body to reduce cortisol, lower inflammatory cytokine production, and shift into repair mode. It sounds simple. It is simple. And the science behind it is genuinely remarkable. Now, the 7th and final point. I told you at the very beginning that I was saving the most important one for last. And I meant it, because everything we've talked about so far, the movement, the sleep environment, the food, the heat, the positioning, the stress response, all of it is amplified or diminished by this one final factor. And almost nobody is talking about it. Have you ever wondered why some people with severe joint damage feel relatively little pain, while others with mild physical findings are completely debilitated? Why two people with essentially the same diagnosis can have completely different experiences of their own body? This question fascinated researchers for decades, and the answer, when it finally became clear, pointed to something that happens not in the joint itself, but in the central nervous system, and it happens most powerfully during the night. Here's the hidden truth that ties everything together. Your body has a natural pain modulation system, a network of pathways in your brain and spinal cord that can either amplify or dampen pain signals before you consciously experience them. This system is regulated in large part by a compound called endocannabinoid, your body's own internally produced pain relief molecule, as well as by serotonin and dopamine pathways. And here's the critical insight. This system is most actively restored and recalibrated during deep sleep, specifically during slow-wave sleep and REM sleep, two stages of sleep that are dramatically disrupted by everything we've talked about today. A study published in the journal Pain, one of the most prestigious pain research journals in the world, found that sleep deprivation and poor sleep architecture directly reduce the threshold at which people experience pain. In other words, when you don't sleep deeply, your central nervous system becomes hypersensitized. It turns up the volume on pain. Every signal from your inflamed joints gets amplified. And conversely, when you protect and optimize your deep sleep, your central nervous system recalibrates toward pain tolerance. It turns the volume back down. This is why every single thing we've talked about tonight matters so much. The gentle movement that distributes your synovial fluid. It protects your sleep architecture. The dim lights in cool room, they deepen your sleep stages. The tart cherry juice and the anti-inflammatory food choices, they reduce the intestinal inflammation that disrupts your gut-brain axis and worsens sleep quality. The warm bath, it initiates the thermal drop that triggers slow-wave sleep. The pillow positioning, it prevents the microarousals caused by joint compression that fragment your sleep cycles all night without you realizing it. The breathing and the progressive muscle relaxation, they shift you into parasympathetic mode, so your nervous system can actually enter the deep stages where pain recalibration happens. None of these things are magic on their own, but together, as a routine, as a sequence you follow every single night, they work synergistically to rebuild the very system your body uses to manage pain naturally. This is what a bedtime routine for joint pain actually looks like when it's built on science rather than guesswork. And so here's where we land. If you're someone who wakes up every morning feeling like you lost a battle while you slept, if you've tried things, researched things, maybe even given up on things, I want you to hear this. Your body is not broken. It is not betraying you. It is doing exactly what a body does when it doesn't have the right conditions to heal. And the right conditions, most of them, happen at night. You have spent years, maybe decades, treating your daytime as a time to manage your pain. Medications in the morning, ice packs in the afternoon, appointments, adjustments, therapies, all of that matters. But the night is when your body wants to heal itself. And if you're in bed without giving it the tools to do that, without the movement, without the environment, without the food choices, without the nervous system support, you are working against the most powerful healing window your biology has. Start tonight, not with all 7 things. Start with 2. The joint mobility before bed, and the progressive relaxation breathing. Do those 2 things for 7 days. Just watch what happens. Because here's the final thought I want to leave you with. Pain changes people, not just physically. It changes how you see yourself, how you move through the world, how much you expect from your own body. When pain becomes your baseline, you start planning around it instead of planning beyond it. And the most profound thing about natural lifestyle-based approaches to pain is not just that they can reduce the pain. It's that they remind you that you are not passive in this. You are not just a body that pain is happening to. You are someone with agency, someone who can make choices. Tonight, right now, that change the chemical environment of your own joints. Your body wants to heal. Give it the night it deserves. If this video gave you something valuable, something you're going to think about or act on, share it with someone who needs it. Someone who wakes up stiff and exhausted and doesn't know why. Sometimes the most powerful thing we can do for someone we love is hand them information that changes their night. And if you want to keep going deeper into natural approaches to pain, inflammation, and healing, stay on this channel. There's so much more to cover. And I'll see you in the next one.